If a parent and family decides that they're going to try first a treatment with psychotherapy, or in some cases, psychotherapy combined with medications, there's two kinds of psychotherapy where there's demonstrated scientific evidence that they work. What we mean by working is that they work better than the already positive effects you get from talking to a nice person. The two kinds of treatments used in children with good evidence are cognitive behavioral therapy, usually called CBT, and interpersonal therapy, called IPT. Cognitive behavioral therapy concentrates on several areas, but is sort of best thought of as concentrating mainly on the negative cognitions, the negative thoughts that children with depression get. So for example, a kid with a depression, they'll come into school, some other kids will frown at them, and the kid with depression will be instantly sure that it's because they're ugly, because nobody likes them, because they're the butt of ridicule, because of whatever. A normal kid would more likely say, well, maybe they're having a bad day, who knows, maybe they're mad at me, I'm not so sure, I'm not going to worry about it. So the depressed kid has these cognitions that over and over make them more depressed. And so part of the therapy concentrates on changing those, being aware of those and changing those. Interpersonal therapy takes a somewhat different approach to it, and it says that one of the most important things in maintaining our mood and keeping us as happy functioning human beings is our interpersonal relationships with other people. Well, what happens when an adolescent or child is depressed? They sit up in their room, they play Nintendo, their friends come over and say, you want to play? They say no, grumble, go back up, and they lose those interpersonal relationships. The interpersonal therapy, among other things, concentrates on that aspect of it, reforming the interpersonal relationships, getting the positive reinforcement from the interpersonal relationships. Those are two approaches to therapy that do work with adolescent depression.